Welcome and thank you for joining us on the Life Sounds Good podcast.
Today we're talking with Elliot Tiede, who's a hearing instrument specialist at Hear Well Be Well, and we're talking about tinnitus.
I'm very excited about this episode because there's a lot to learn about tinnitus, and there's a lot that people don't understand about tinnitus, so I'm excited to learn.
So am I. Stay with us, because as you know, life sounds good. Thanks for joining us today, Elliot.
Thanks for having me.
Tinnitus has actually two pronunciations. Is it one's American, one's Canadian? Because I've heard tinnitus and I've heard tinnitus.
I think it's potato, to be honest. I don't know if it's one's American, one's Canadian, one's British. I'm not sure. But essentially, it means the same thing.
And what does it mean?
It means a perception of sound in your brain, right? A constant noise that is not coming from your external environment.
So like ghosts.
Like a ghost in the brain.
An audio ghost.
An audio ghost,
An audio
yes.
ghost. So people hear lots of different kinds of sounds.
Mm-hmm.
What are some of the most common sounds that people hear that aren't really in their environment?
So most common perceived tinnitus is more of a high-pitched ring or buzz. There's lots of different reasons for where the pitch, is perceived, depending on the underlying cause of the tinnitus. So generally, tinnitus is caused by a high-frequency hearing loss. The nerves are starting to deteriorate in the high frequencies, and that can be just age-related. It can be caused from noise-induced hearing loss, ototoxic medications that are degenerating the nerves sooner than they would like to, and we tend to lose our high frequencies first. And so when we have this absence of nerve signal to the brain kind of generates a signal itself. It's kind of like, what's that called, when people lose a limb and phantom pain. Because there's no signal there, the brain tends to make one up. So like you get itchy on that limb that doesn't exist, okay, but you can't scratch it. And that's kind of what tinnitus is like.
So with tinnitus, the brain is trying to fill in the blanks. Would that be kind of what's happening?
Yeah, that's kind of what's happening. And so if they have a high-pitched hearing loss mixed with a low-pitched hearing loss, this can cause a combination of sounds like a low hum with the high-pitched squeal that's happening in their head, and then it could sound like a zzz in combination, right? So that's why everyone's tinnitus is unique to them. Some of the common causes of tinnitus is ear infections. It could just be a wax block, right? Again, limiting how much sound is getting to the eardrum, which is passing to the nerve, to the brain. So that could cause tinnitus to be more present. We generally notice tinnitus the most in quiet environments where there's a lot less sound going on. So there's also diseases of the heart and blood vessels. So there's tinnitus is related to blood pressure issues,
okay.
Hypertension, things like that. Meniere's disease, that's generally one-sided hearing loss where there's a build of pressure within the cochlea. There's fluid in there and they have excess fluid and it causes some kind of issue there. And it can fluctuate, so your hearing can be better one day and worse the other, or even throughout the day. Brain tumors, emotional stress, exposure to certain medications. Okay, we talked about ototoxic medications, and possibly previous head injuries can also cause some ringing in the ears.
So there's this wonderful thing that I suspect, at least 80% of the people who've experienced it have probably Googled it and discovered that hearing your own heartbeat in your ears thing is called pulsatile tinnitus.
Mm-hmm.
And gosh golly, did I ever have that badly a few months ago.
Oh.
And it was driving me mad, just mad. And I actually texted Elliot and said, this is what's happening to me. How do I make it stop? And that was the sound of my heartbeat. I just can't begin to imagine how people would deal with all the various sounds that would not have that kind of rhythmic, oh, that's the beat of my heart that I'm hearing. But Elliot, when I reached out to you, you posed some really good questions to me. Do you remember what those questions were?
I don't recall 100%, to be honest, but I'm sure I said, like, have you had high blood pressure? Are you under a lot of stress? I'm sure I mentioned those things right away, because I even saw a client recently in our Meaford clinic, and he was a retired police officer, and he's been having tinnitus, and he's wanted to get his hearing test. He wanted to get a baseline, and he had normal hearing, which I was surprised as a police officer exposed to shooting and things like that. But most of it was with hearing protection and a range, which was good. So he protected himself really well, but he's had tinnitus for many years. And I asked him about, what's your blood pressure like? And he said, I've had blood pressure or high blood pressure for many years. And he is also on blood pressure medication. So, and I've had issues where, like, I became overwhelmed with stress and my ears just went wee. And it wasn't until you took the time to kind of relax for that tinnitus to go away. So I know I kind of veered away from you there, but
no, that's okay, because it's not all about me. But the one thing that you did say to me when I was suffering that pulsatile tinnitus was the suggestion to take a decongestant and see if that made a difference. And it did. It took about 36 hours before I saw the difference, but yeah, it was kind of amazing. So that's going to be my test as to whether I'm just over the top congested, is whether my ears start thumping.
And again, like, if you have some fluid or some excess pressure built up in the middle ear, right, your eardrum is not moving as efficiently, and we're not perceiving sounds as loudly, and therefore when you're in this quiet environment, like at night when you're laying in bed, you're going to hear more of these internal sounds than you are going to hear these external sounds. And again, that can be perceived as tinnitus, or you're hearing your heart a lot more, the blood moving through your body.
It's wild creepy.
On the Google note, it's funny because everybody does go down that Google rabbit hole when they have something, and I've done the same thing. And one of the things that I found, and I'm just curious as to the validity of it, and then a question about it, is that I read that it can be caused by the loss of the hairs inside in your inner ear. And if that's the case, what I didn't know, but it did make me raise the question that oh my God, if that's the case and that's happening to me, do those grow back? So I'm just wondering what the validity of that, because these are some of the things that are very commonly stated on there. That was kind of in the top 3 or 5 on there repeated. So
absolutely. So unfortunately, they are nerves, right? And we don't have the ability to restore nerves yet. I'm sure they're working on something to support that. But currently, right now, once our nerves start to degenerate, the little nerve, the hair cells, those are the nerves that send the signal to the brain that need to get stimulated. When they start to go, they tend not to come back. And if left untreated, because that's a hearing loss, right? If the hearing loss is left untreated, we see that the hearing declines over time. All right, if we're not stimulating those hairs, because there's just not enough amplification, there's not enough sound pressure to get to those damaged hairs.
Gotcha.
They tend to deteriorate sooner. It's like, if you don't use it, you lose it kind of deal. So with the use of hearing aids, we're able to pinpoint where those hair cells are and add amplification to stimulate them. And what we find is there's a drastic decrease in hearing loss with the use of hearing aids, with a properly fitted hearing aid, and are using it, at least 8 hours a day, not intermittent wearers. Right?
Gotcha.
They have a hearing aid, but it sits in the drawer most of the week, and they're I've got this family gathering, or I'm going out to a restaurant, or I'm meeting friends, I'm going to pop them in.
Which isn't going to do anything for that. It's not going to regenerate, but it's going to sort of slow that degeneration. Using them just now and then isn't going to help that degeneration.
It's not treating it. Right? Yeah. It's not giving that constant.
That's really interesting, actually.
That
really puts something to be said on just the fact of that if you have them or you need them, that wearing them continually, not just when you need them, actually has that massive benefit. I never actually considered that.
Yeah, I've read some white papers on it, and essentially those with an untreated hearing loss, or those who intermittently wear their hearing aids over the course of 5 years, their hearing declines by 16%.
Wow.
It snowballs. It gets worse faster. And those with a treated hearing loss who wear their properly fitted hearing aids at least 8 hours a day, all day, every day, their hearing over the same 5 years will decline by 1.8%. So
that's a dramatic difference.
Yeah, almost 10 times slower.
Wow.
So, and I've seen it happen. It's not just, reading up on it. I've actually seen this happen with clients of ours over the course of even 2 to 3 years, where, if they were fitted with one hearing aid and they had hearing loss in both sides, the side that they were fitted, their hearing maintained that level, and the other one showed degeneration of the hearing, even within that 2 to 3 year period.
Wow.
That's amazing. And it's interesting because all the research around dementia and its connection to hearing loss also demonstrates that if you wear your hearing aids consistently, so at least 8 hours a day, that if you do have dementia, it can slow the progression of the dementia by up to 50%.
Wow.
So it kind of cuts its speed in half if you wear your hearing aids regularly. So I think people don't understand that the hearing aids and the hearing loss are connected in so many different ways.
Connected to so many different branches of your health, right?
Right, exactly. It's crazy. If we step away from dementia and go back to tinnitus, you had talked about high blood pressure, some coronary diseases, that kind of thing. I think we've determined that if you've got tinnitus, get a hearing test because it's likely there's some hearing loss attached to that. What are some other things that people can do? You talked about there being high stress and that kind of thing. For people who need to, they don't have a day off, so they have to wait for a couple of weeks to get their hearing tested or whatever, are things like meditation or yoga or soft music? Are there things that people can do to help them through the experience of dealing with the tinnitus while they're waiting to get a hearing test?
Well, first of all, I think I need to say that I'm not a doctor, but there is cognitive behavioral therapy that you can do to help support tinnitus that is not caused by hearing loss. There's tons of natural supplements out there that can reduce stress, cortisol levels, things like that, reduce blood pressure. But again, you want to consult your doctor on any of these things if you're going to be taking supplements. But yeah, you'll see tons of advertisement online where there's a supplement out there that says this will get rid of your tinnitus. Okay, and then you read the ingredients, and it's just a ton of calming kind of ingredients like vitamin B and just relaxing agents.
Right. Yeah, I've seen those ads.
Yeah.
Yeah, I actually consider them to be wildly misleading.
Well, it could help if that was the cause of the tinnitus, but if hearing loss is the cause, this will never support the reduction in tinnitus.
Have you seen the ads with the spoon?
The spoon?
Yeah, there's ads out there that there's a picture of a spoon sitting next to your ear.
Oh yes, I've seen that where they're tapping at it.
Yeah, saying that they'll cure your tinnitus with the spoon.
No, I have not.
Oh, lucky you.
one of those crazy ads that are up there that you just kind of pause and go, I'm pretty sure this is not legit.
Yeah, it's kind of scary, actually.
Well, there's a lot of misinformation put out there, right? And there's a lot of people who want to try to benefit from other people's situations, so you have to be careful where you get your information from and make sure that it's legitimate. That's why I actually can appreciate that from Elliot saying, well, first thing, consult your doctor.
Right.
Yes, there are options, but let's talk to the professionals first.
Yeah.
Absolutely. And, take a good look at your environment. Take a good look at what you're putting in your body. Excess salt, excess caffeine, even alcohol can cause blood pressure issues. Smoking, excessive amounts of aspirin or antibiotics. And again, talk to your doctor about this.
What about, you see a lot of people these days using inner ear like earbuds that push into their ears. Can that type of thing contribute to tinnitus or anything like that? I just imagine you're constantly packing whatever's into your ear back into your ear and not letting them breathe out. So I tend to myself, just for personal preference, stay over the ear. But is there something to inner earbuds and things like that can contribute to this type of thing? Or is that just sort of a myth?
Well, if we're talking about noise exposure, it's about how loud it is and about how long you're exposed to it.
Okay.
Right? So there's safe levels that can be, you can listen to for hours at a time, but if, you hit a certain point, like, you're going to cause deterioration. So there's safe levels and there's unsafe levels. So like a shotgun blast, right? You're next to someone shooting, or you're that one person, you're the individual shooting. It's so loud but so quick. There's instant nerve damage. There's a little notch in your hearing system now. Permanent nerve damage. Yeah. And every time you take a shot, it just gets another notch, just in the same region, because it's the same kind of sound,
frequency, same level. Sound. So just kind of digging a hole in that portion of your nerves.
That's right. Yeah.
Wow, that's really interesting.
So we see hunters or recreational shooters that don't use hearing protection regularly. Sometimes it's an asymmetric loss, so meaning one ear is worse than the other. So if you think about when you're holding a rifle, you've got one ear kind of tucked.
Yep.
Okay, that's the protected ear. This one, it's not completely protected. It's still going to get exposed, and there's definitely noise-induced hearing loss in that somewhat protected ear. But you'll notice that the other ear that's wide open gets more damage.
It's taking all of that force from it.
That's right.
That's really interesting, especially that it keeps, and it makes sense that it's the same sort of frequency, same sort of level, that it keeps digging into that one spot. So if that's something that you're doing as part of your life or your hobbies, then you're literally just chipping away at that part of your ear constantly.
That's right, yeah.
What's the best kind of hearing protection for hunters?
Any.
Good answer.
That's a good point, because a lot don't use any, right?
Yeah. So damage, actual noise-induced damage, high blood pressure, alcohol smoking,
fluid drainage,
fluid stuck in your ear. Yeah. So there's lots of different reasons people will have ringing, buzzing, humming, heartbeats, and things. What's the ultimate signal that they need to come for a hearing test?
Well, first of all, I mean, if we're talking just tinnitus alone, right? If it's something that you're noticing on a daily basis for prolonged periods, you should definitely get your hearing checked. That's the first thing you want to do. There's lots of signals that could be said to tell you should be getting your hearing tested, but tinnitus for sure is one of them. Right, if you're hearing it constantly, not just that 15-second little chirp in your ear, that's not necessarily a big deal. But if it's something that's happening all day, every day, or for hours at a time, definitely come in for a hearing test. I mean, there's other signs. Obviously, you're struggling to understand what people are saying. Right, you're turning the TV up louder. You're moving in closer to understand speech one-on-one. If you're struggling with understanding someone at a distance, that's also, you got to take into account like how far you are, right? Because if you look at just the physics of sound, every meter you put it between you and the sound source, that sound has halved its volume. So it's an exponential drop in sound. So if you are across the room 40 feet away, and again I'm mixing feet and meters now, welcome to Canada, you're going to notice that it's more difficult. That person over there speaking must increase their volume so that it hits that individual at a level that is easy to hear. When you put a wall in between that, right, that's going to muffle sounds even further.
Yeah.
Mm-hmm.
How do hearing aids help? And part two of that question all of a sudden came to me. Can hearing aids help someone with normal hearing who has outrageous tinnitus? So two parts to that question.
So normal hearing range is very wide. We are testing through audiometry. The normal hearing range is minus 10 dB HL, and that's hearing level, okay, to plus 25 dB. So that's a 35 dB range. Right? It's a significant range. And if you started life off with a sensitivity of minus 10 at the lowest level, and you are able to hear at that level, fast forward 40, 50, 60 years, and now you're at the end of that normal range. Your brain is still, saying this is my 0 or minus 10 is the level that I'm looking for. And now that it's declined to 25, which is technically normal, it could be perceiving some tinnitus. And if that's the case, hearing aid amplification can support that, because we're stimulating those nerves again to bring them up to that minus 10 level so that they're getting that stimulation.
As an example, just for my brain, I'm sort of seeing an audiogram in front of my face.
Mm-hmm.
So after we leave normal hearing, we go to mild hearing loss.
Mm-hmm.
And that's 25 to what?
So mild is just like a 10 dB range, so it's 25 to 35. Yeah.
So with what you've described, and I had never thought about this, I'm quite intrigued by this. If you were born with a sensitivity at minus 10,
mm-hmm.
and you then go to say plus 15,
mm-hmm.
that's a 25 dB difference.
Yes.
So if you started at 15
mm-hmm.
as your sensitivity,
yep.
you'd now be in the official mild hearing loss range. So
yep.
you could be in the normal range that's,
mm-hmm.
Human average kind
yep.
of situations.
Mm-hmm.
You could still be in the normal range, but you could have hearing loss as far as your brain is concerned.
Yes.
Mm-hmm.
I had never thought of that.
Really interesting.
Yeah. That is,
yeah,
that's going to be swirling around in my head for most of the day now. That's really interesting.
It's trippy for sure.
Huh.
Are there any environmental elements that can contribute? I mean, obviously certain high decibels, things like that, certain things can contribute to your hearing loss, but is there anything that can environmentally trigger tinnitus without having actual hearing loss? Like, is that something that can happen, that I can be out or at an event or at a different environment and have a sound or have something happen or be exposed even? I don't know, I'm asking out of pure ignorance, like mm-hmm. even dust in your ears, different debris. Is there anything other than hearing loss that can cause the symptoms of that we haven't talked about, like environmentally?
Sure. I mean, yeah, if your ear canal gets plugged up with debris or wax, right, it's going to cause sound is going to struggle to get to the eardrum, which is then going to struggle to get to the nerve, which then creates this artificial quiet environment. And then you're in, even when you actually get into a quiet environment, it's further exasperated, right?
Mm-hmm.
So then you can have that tinnitus. If you're talking about like going to a concert or something like that, and you're exposed to loud music for a couple hours, and you come home and you leave and your ears are ringing, there could be a few reasons for that. We do have a natural protection mechanism within the ear. It's actually behind the eardrum. There's 3 little bones, and on those bones are little muscles. And when they're exposed to a loud sound, okay, they actually lock up and to protect the nerve.
That makes sense. Like, right? Your spine, if you have a mild injury or something, mm-hmm. your muscles lock up to protect that.
You get tight, right?
Yeah.
So what's happening is it's all tight, and when they're tight, the eardrum and bones aren't rocking as efficiently, so they're very stiff. So that causes the muffled sound because we
Okay.
need fine movements for high frequencies to come through, but you're still hearing like, the lows and the mids. And then we have that high pitch ring because, again, we're not getting those high pitched sounds to the brain because we've limited them by the movements of the physical movements of the eardrum and bones.
Gotcha. So in those scenarios, I mean, if you've got that exposure from a concert, you need to let the muscles relax, give it time. And if you've been in an environment like that where you might have debris then coming for a hearing test, where you might be realize, oh, we can just clean your ears, and that will relieve that. Am I taking that correctly?
Oh, absolutely.
Okay.
Yeah. I mean, when you have a complete wax block in your ear, it creates a 20 dB reduction, which is like 16 times quieter than normal.
Wow.
Yeah, it's like walking around with an earplug or hearing protection. May be good for hunters.
As I say, it's almost like if you don't wear your hearing protection, you're going to get some natural hearing protection.
That's right.
That you don't want.
For sure. And
my
again,
gosh.
that leads back to the earbud thing, right? If you have a lot of earwax production, earwax is just a mixture of body oils and dead skin. Body sheds skin everywhere. And what happens is earwax is formed from the shedding of the canal wall, and it starts in like a spiral like fashion from the eardrum working its way out of the ear, and then we go and we shove Q-tips or earbuds or sometimes noise protection plugs, and we push that wax in, and over time we can compact that wax to the point where it's blocked or even pushed right against the eardrum. And again, if it's against the eardrum, like it's not vibrating efficiently, so it's going to cause things to be even quieter. So when I see someone with a wax block, and it's been a while, right, you can tell that it's been a while. If the wax is very dark, like black color, okay, it's been sitting there for some time. I let them know, I'm like, be gentle with yourself because the world is going to be a lot louder than what you've been perceiving for some time, okay? And it will take a little bit of time for your brain to calibrate to this new input level that you're going to receive.
That makes sense.
Yeah.
That makes sense. That's a little bit like somebody who's just got new hearing aids, who has been not experiencing the whole world, and then all of a sudden they are. It's just such a black and white difference, right?
And I've been sitting here just really quietly because I'm like so grossed out I can't think clearly.
This is what goes on in the human body.
Yeah, well, yeah, but the idea that somebody could get that much earwax in their ears and it sits there long enough to turn black, like, I'm sorry guys, but I'm totally grossed out here. Just totally, I don't know.
There's a valid point on that, which sparks the question. Is there anything to be concerned about hygiene and health-wise if you leave something, like if you had wax buildup and it's been in there so long that it's turned black or whatever, are there risks to that?
I mean, especially if we're showering and we're getting water and some water gets behind that wax and it gets trapped. Like when I pull out some deep wax buildup, you can see behind it that there's a lot of white kind of dead skin that's been sitting there shedding, and it's gonna rot.
Yeah.
Okay, seriously, you just asked that question to make me even more grossed out. That's
right.
That's really where we're going here.
It should be cleaned out.
So at what age does tinnitus pose a risk?
I think at any age.
Changing topic.
Thank you, Dad. Stop grossing me out. I can't.
But before we leave earwax alone, some people, unfortunately can't help it based on their anatomy. Okay, some people have very narrow and bendy ear canals, the channel. Okay, and it just doesn't allow the earwax to shed easily. And we have collapsing canals. That's where the ear closes itself off naturally. It just the ear loses its elasticity and it starts to just kind of close itself.
Wow. Okay.
And that is within 10 to 15% of the population where you have that collapsing canal. So just by the shape and size of the canal and collapsing, it can be very difficult for the ear to shed wax on its own.
So what do you do?
Get it cleaned out professionally.
Yeah, and it does make sense too that it's, people shouldn't feel stigmatized or feel bad about that it's just a part of how your biology is built up.
That is an important note. For the majority of people, that wax buildup is not their fault.
Exactly.
It's just how your body is built. And, for the people who have ears that cooperate, wonderful for them.
Mm-hmm.
But it's so important to look after your ears. People just don't they don't get
how connected all of that is.
Yeah, exactly. It just
Some people might not accumulate wax over years, right?
Yeah.
I see people and they're clear, they don't use Q-tips, that it's just not an issue for them.
Yeah.
They generally have more of like a more open and straight canal. It just has the chance to fall out easily, and the body is designed to push it out just as we talk and chew. Like there's the jawbone actually pinches on the canal as we open and close our mouth, and that facilitates the movement to kind of gently push it out of the canal, and it just falls out. And then we see clients who are the complete opposite and can build wax within weeks, which is wild. But generally, there's not too many people that have that issue, but you see, every 6 months, right? It's probably a good idea for you to get your ears checked and flushed out or vacuumed or curetted with, instrumentation where you can just grab it and pull it out. But generally, once we introduce hearing aids, wax becomes more of an issue, okay? Because
you've got something covering there.
You've got something in your ear all day, every day, and it's not allowing the wax to fall out naturally. So wax removal can affect the performance of the hearing aid as well, because if you're pushing the hearing aid in and the speaker component gets plugged with wax, it's not going to be able to send sound out, right? It gets blocked right up. And people will think their hearing aids are broken or dead or something, and really they're just dirty and they need a cleaning. And certain hearing losses require varied degrees, sizes of vents that allow natural sound to pass through the hearing aid or the mold. And if, again, wax fills up that vent, it's going to change their sound perception significantly. So it's not just the speaker, it's also the vent of the hearing aid that requires cleaning.
So if I had, and this is just sort of a what if type scenario, if I had hearing aids and I had, say, neglected to monitor clean my ears, have them cleaned, could I then start exhibiting symptoms of tinnitus because of that lack of maintenance inside, even though I have the hearing aids?
It's interesting because some people who have hearing loss don't have tinnitus, and either they actually don't have tinnitus or they just brush it off. Sure, I've got some degree of tinnitus, it doesn't bother me, it's not affecting my life, so they don't even bring it up. So it's hard to say.
Interesting.
Yeah. But I mean, if the tinnitus is caused based on a hearing loss and the wax is getting in the way, the nerve's not getting stimulated properly by the sound because it's cutting it off, then yeah, that's definitely gonna create more tinnitus.
You talked about people with hearing aids having their, properly wear them for your life, people, but that this is now blocking the opportunity for the wax to get out. And I just kept having this picture in my head of all the people that I see wandering around with earbuds. They do their phone calls with the earbuds. They're playing their music with the earbuds. And, those passionate people that you see driving with their earbuds. And so we've got people who are wearing earbuds for like 8 hours a day. So are we going to see an increase, do you think, in the amount of people with wax blockages in their ears because of people's propensity to have these bloody things shoved in their ears all the time?
I'm going to say yes. It just makes sense, right? Unless you're an individual that really doesn't create a lot of shedding and body oils, then, you're not going to have that issue as much. But a good chunk of people, there's going to be an issue, right? And if you start putting in your earbud or your hearing aid and you pull it out and you see that there's this coating of wax on it, it's all gummy, that is a sign that you should be getting it cleaned out.
Wives' tales, old wives' tales. When you have a wax blockage, put hydrogen peroxide in your ears.
Okay.
I grew up with that if there was if my mom thought our ears were dirty, we all had to get the hydrogen peroxide in our ears. Does that make a difference?
Well, just think about what it does, right? It just causes this gentle bubbling action. There might be some degreasing component to it, so it's going to help break it up gently. But again, if it's not flushed out, it's just going to sit there inside the ear. So it's just sitting in there much softer, but again, it needs to be flushed out. But because we have, the ability to take a look in your ear, right? Not too many people have seen even the inside of their ear because it's just very difficult to do. We have special cameras, we have otoscopes, handheld otoscopes, and we can take a look. Like tinnitus can be a real problem for a lot of people, especially if it is, really interfering with their day-to-day living. They hear this ring inside their ear or their brain, and they might ask someone, do you hear that noise? And they're like, no, what are you talking about? And it just doesn't go away, and it can really cause them to go down a path of self-isolation and depression. They have terrible thoughts about themselves, like what's wrong with me. It can go as far as I'm different than everyone else, so I'm unlovable, or life is hostile, like what's going on. Like you just literally go into these terrible thoughts, and they don't want to be a part of interacting with people because they something inside, I'm different from them. They don't know what's going on. They don't experience this, and they can really isolate themselves. And if that's happening to you, you should really seek treatment. Go to your doctor, get a hearing test.
Mm-hmm. Well, I thought I was going mad when I had the heartbeat thumping in my ear for days and days, because it had gone on for like 3 weeks of continuously that noise being there, and seriously, I thought I was going to go mad with the constant sound. Yeah. And so I can totally see how someone living with that doesn't have an Elliot, that when you're finally at the end of your rope, you can text Elliot
because
and see what can I do about this.
It's a snowballing effect, right?
Yeah.
Like it starts small, but then you reduce your interactions more because you're not going to experience it, or you're having a hard time or feeling discomforts, and that then you're alone more, and that starts to change your mental state. It's a snowballing effect. I hear where you're coming from on
Absolutely. That. And people might start avoiding staying in quiet environments, because if they have some sort of sound in the environment, it's masking the tinnitus and it's not as perceived as loud. So that can really interfere with your sleeping patterns if you're trying to use a noisemaker.
I didn't think about that, how much it would disrupt your sleep habits and how that would affect your everyday
life, right? And then generally there can be some combination of things happening with tinnitus. It causes people to become a little bit more hypersensitive to sounds in their environment. They think that they have damaged ears, so then they develop hyperacusis. So hyperacusis is sensitivity to loud sounds. So any kind of elevated sound, they're like, no, I've already got some damaged ears, so I'm going to be over the use of hearing protection and avoiding loud sounds, or avoiding going out to family gatherings or restaurants or things like that. So it's even further isolating. And it can go as far as misophonia, which is being triggered by certain sounds, like someone breathing or chewing, and they actually, it triggers them significantly to the point where they overreact on a little sound that is common in every day.
But it's driving
them nuts.
Yep. Okay. That's understandable.
So it can really lead you down a path of not good things. So it's really important, if you're starting to experience tinnitus, to find the underlying cause of it. And if it's not hearing loss, take a good look at what's going on in your life. Go see a doctor. They'll probably recommend cognitive therapy, behavioral therapy. If it's something that's happening all the time and they've tried whatever they can, they've changed their diet, etc. They think they have this amazing diet and no stress. But I think with anything, if you're not finding something that works for you, keep on looking. Get a second opinion, get a third opinion, get a fourth opinion. Okay, there's so many different modalities out there, right?
But that there's something wrong, so you need to find a solution.
Yeah. And I think that's with anything,
Yep.
with your body,
Yep.
right? If there's something wrong, find that thing that helps you.
Because again, with this, after our conversation, I can see that. But before we started here today, I didn't have any comprehension of how far down that hole that could lead with that snowballing effect. I just thought irritating noise, get rid of it, deal with it, whatever. But when you start to think of how the small things, if you don't deal with it, how they start to stockpile and build up and then weight down on you, that I didn't consider. That is really important to how that can affect you. You might not even realize that it's happened until you're down that hole.
Yeah. I think there was even what's his name from Star Trek who has tinnitus really bad. Captain Kirk, what's his?
Oh, William Shatner.
William Shatner. He went down that path, and he needed to get taken off the ledge.
Wow.
Yeah. So he's talked about his path, his story with tinnitus.
Yeah.
So really interesting.
Yeah, and his was caused from explosions on the set.
Could very well be.
Yeah, he was too close to
exposure.
Explode. So so his was an exposure result, as opposed to mine, which could have been a combination of congestion and stress.
Yeah.
So
it's amazing the spectrum that it could be caused by too, right?
Yeah.
I mean, so again, it's something to, when you start to experience it, start troubleshooting, I think is the message.
Right.
Yeah. Go to your doctor. That doesn't work. Go to a naturopath. That doesn't work. Go to a herbalist. That doesn't work. Go somewhere else. There's so many things, and maybe it's change your diet.
Can I add? But don't go to Dr. Google.
We've demonstrated that road is not positive.
Right, exactly. Because even though you can find all kinds of supportive information and other people who are going through what you are going through, people's solutions may not be the thing. Talk to a professional in any of those categories. But don't just read something on Google and decide you're going to start sticking spoons in your ears or something.
Yeah, because their solution is not necessarily the right solution for you, and your solution is not necessarily the solution for them.
Right.
As Elliot's discussed, there's so many directions that the solution could come from that you have to start that investigation.
Yeah, agreed.
Yeah.
Agreed.
Elliot, thank you so much for joining us and sharing.
Thanks for having me.
I'm actually wondering if we shouldn't investigate the idea of nutrition and your ears. That could be another
very good
episode
topic.
later. Yeah,
absolutely.
That could be really interesting.
Absolutely.
Thanks again, Elliot. Really appreciate it.
Anytime.
And thank you for listening. Don't forget to subscribe on your favorite podcast source and like us on Facebook so that you know when a new episode is coming out. And see you again, because life sounds good.